This segment is sponsored by Urology Austin and Medtronic. Well, folks, today we're discussing common bladder problems that affect millions of men and women across the U.S. Joining me is Dr. Rachel Sosland with Urology Austin. Good morning to you.
Good morning. I'm so excited to be here.
Well, I am so excited to be here too because, even though we're talking about common bladder problems, we're going to basically make sure that folks know that they're not alone with this. So talk to us first off about how common bladder problems are.
Definitely, they're extremely common. 37 million Americans have bladder problems and really overactive bladder. So that's 1 in 6 men, and in women it's even more common. 1 in 4 women experiences urinary incontinence. People are really embarrassed to talk about it. It oftentimes affects people's confidence, their relationships, their ability to go out, to travel, to work, and so you're not alone. We can help you, and at Urology Austin, we're really good at fixing these problems. So because it's so common and because there's been so much research in this field, we've been able to come up with a lot of treatment options.
So you do have solutions, and I do like that you are saying, let's break the stigma, let's talk about it, let's educate, the audience a little bit. So folks know, of course, they're not alone, but also there are ways to treat this, and there are things that we can look out for that are symptoms. So we're going to talk about stress incontinence today. We're going to talk about overactive bladder and urinary retention.
Yes.
Let's start with basically the A to Z of stress incontinence.
Okay, great. So stress incontinence is really a weakness in the pelvic floor. That's why it happens. So when people talk about incontinence and they come to my office and they tell me that they're leaking, then we have to figure out why that is. So stress incontinence, when you think about that, is really leakage with coughing, sneezing, exercising, or straining. So oftentimes people can have this after childbirth. They can have it after surgery on their prostate, whether that's for a big prostate or for prostate cancer. I see many patients who are athletes who have stress incontinence as well. So it's really straining and then leaking from straining. Again, we have plenty of treatment options for that. So generally we start conservatively and we move from kind of conservative to more aggressive treatment options. So for stress incontinence in particular, the first thing we do is pelvic floor physical therapy, and we try to re-strengthen those muscles that have weakened. So we have dedicated pelvic floor physical therapists. We have several at Urology Austin, but also people can do strength exercises at home. If that fails, there are other options. So either with a minimally invasive procedure, either in the office or in a surgery center, or with a small surgery, we can really try to reconstruct that weakness, that pelvic floor weakness, and fix the incontinence problem.
All right, I like that there is a solution. Let's talk about the next common problem that you see a lot, an overactive bladder.
So overactive bladder, or otherwise known as urge incontinence, we have 2 different types. There's overactive bladder wet and overactive bladder dry.
Okay.
So in general, these symptoms are frequency, urgency, rushing to get to the bathroom, kind of the inability to hold the urine. So I have several patients who will map out where they're going to go to the bathroom before they go somewhere. When they're in the grocery store, they'll kind of know where everything is. Many patients, when they start to brush their teeth or do dishes, will have that urgent feeling like they've got to go. Many people will wake up at night to pee. When they leak, then it's OAB wet, or overactive bladder wet, which causes incontinence. And so again, that can be really alarming to patients because they can't anticipate it. So you don't never know when that's going to hit, when you're going to have to go to the bathroom.
A little bit scary.
It is scary. It is scary. And so, you can't anticipate it. And so, again, we have this pathway. And in fact, the American Urologic Association came up with a pathway that it endorses. And so we know how to move through it. And a lot of practitioners can move through this pathway where, again, we start conservatively with avoiding things that are irritating to the bladder, things like caffeine, alcohol, spicy food, or citric acid, citric food, which can irritate the bladder lining. So we kind of avoid those things. We can also do pelvic floor physical therapy to help relax the bladder. And then we have medications. So there are 2 different types of medications, and we can find medications that work for patients. And if those fail, then we move on, and we may do some bladder testing, but we have 3 third-line treatment options that work really well to fix the bladder. The first one is something called Botox injection. So
a new way to do it.
That's right. So you can put Botox. We've used it for many, many years in different parts. People use it cosmetically in their face. They can use it for migraines, in the neck. We we also use it in the bladder.
Okay.
So the idea is that we're going to relax the bladder. Bladder is a muscle and it squeezes, so we want that to be relaxed. So with a short procedure, with a little camera here in the office, I'll go in and I'll fill up the bladder. It takes me about 2 minutes to do it, and then I'll inject Botox after I put a numbing medicine in about 10 different spots. And Botox lasts for about 6 to 9 months, and then you have to repeat the injection, but people get a lot of benefit in that time period.
Wow, that is fascinating.
And that's one option.
Oh my goodness.
And then we have some other options as well, which
Okay.
are really exciting. So for people who aren't a candidate for Botox injection, we also have something that's like a pacemaker for the bladder, made by Medtronic. It's called an InterStim. It is like a pacemaker. It works to neuromodulate. So overactive bladder can also happen because the nerves that go from the brain and the spinal cord down to the bladder are kind of out of whack. So we are working to regulate that, to calm the bladder down so that you can fill more and go to the bathroom less frequently, and then hold it till you make it to the bathroom. So with just a little wire that goes down next to the nerve that supplies the bladder and the bowel, we can hook that up to a little battery pack like a pacemaker, and then it gets implanted in the fat over the bottom. And it's all under the skin, and that lasts for up to 10 to 15 years without having to exchange the battery. And we have a couple different options on rechargeable and non-rechargeable options. The third treatment option, when we get to those third line therapies, is something called Percutaneous Tibial Nerve Stimulation. So think about it like acupuncture. We use a tiny little needle, much like an acupuncture needle, and we insert it in the tibial nerve. That's the nerve on the outside of the ankle. So this is all the way down by the foot. And that will actually go back and change the modulation between the brain and the spinal cord and the bladder to help relax the bladder. It involves a 30-minute treatment once a week in our office for 12 weeks. And then after those 12 weeks, to maintain the benefit of the therapy, you need to come back once a month to get a 30-minute treatment. You come to the office quite a bit, but for people who are not interested in Botox therapy or who are not candidates for InterStim therapy, it's a really, really good option.
Wow, I had no idea. Like, this is a lot to take in, but really great that there are so many different solutions. And let's finally cover urinary retention. What's that all about?
So urinary retention is when the bladder incompletely empties. And that can happen for a lot of different reasons. And those reasons are often different in men and women, and they can be different at different parts of life. So as you age, they may be a little bit different than when you're younger. So part of our job as urologists is to figure out, is the bladder safe and are you emptying it well enough? And so some of these devices, like the Medtronic InterStim, is actually FDA approved to help with urinary retention as well, as long as it's not blocked. But there may be some other things that we need to investigate. For example, in men who have prostates, they may not empty completely because their prostate's enlarged. So we have to rule those things out. And we have to figure out really if it's a bladder problem or if it's downstream from the bladder, like if it's the prostate or potentially prolapse in a female where she's not completely emptying because of the pelvic floor. So part of our job as urologists is to examine the patient, ask the right questions, and try to figure out what we're really dealing with so that we can kind of direct the right treatment option.
Well, you just gave us quite the education here. I feel like I walked into here knowing nothing, and I'm going to leave here knowing a whole lot. But that is part of what you really take pride in here at Urology Austin. So can you talk to us just a little bit about the practice itself and how folks can find more information?
Absolutely. So we have 18 different locations around Central Texas, and I love Urology Austin and my partners because I think we're really dedicated to improving the quality of lives of patients. And we're all well trained in many aspects of urology. There are several different practitioners here at Urology Austin who treat overactive bladder, urinary retention, and stress incontinence. And so if you come in for a consultation, we'll sit with you and we'll work through all the different options. And if we can't help you, we'll get you to the right person.
Dr. Sosland, I really appreciate your time today, and I am leaving here a much smarter woman. So thank you so much.
Absolutely. Thank you so much for having me, Stephanie.
Urology Austin has 18 Central Texas locations. To find one near you or to learn more about how they can help, go to urologyaustincom. This segment is sponsored by Urology Austin and Medtronic.